Time now for the live coronavirus update for San Antonio and Bexar County.
Joined by Dr. Colleen Bridger, Metro Health, and this is our COVID-19 update for the San Antonio community. Tonight we are reporting 1,752 new cases of COVID-19, which brings our total to 166,022 since the pandemic began. Our 7-day rolling average is down slightly from yesterday to 1,459. I'm very sad to report that we do have 20 new deaths to report tonight, all occurred within the last 14 days. That brings our total number of deaths to 2,027. Please join our entire community in praying for their loved ones this evening, and remember that every single one of these numbers that we report to you every night is a mother, a father, a daughter, a son, a brother, a sister, someone who is very missed. So please keep them in your prayers. We are seeing some positive developments in our hospitals tonight. We are down to 1,276 patients in our local hospitals. That's down 65 from yesterday, so a big drop there. There were also a lower number of new admissions over the last 24 hours, 132. 397 people are in intensive care with COVID and 249 on ventilators. Let me turn it now to Commissioner Rodriguez.
Thank you, Mayor. And yeah, I guess a little bit of good trending at least. I guess we don't want to call it a trend quite yet, but it looks like the hospital numbers are down a little bit, so that's good news for our community. But continue your due diligence. I did want to make, with the time I've got, just a couple mentions of folks. You mentioned, Mayor, that we lost 20 more members of our community. I know this is probably not in the tally quite yet, but we did lose a Bexar County family member, an employee, Roman Gonzalez, who was 59. Worked in our fleet maintenance department, 6-year employee of the department. I think that now brings to 6 the number of county employees we've lost to this deadly virus. So we want to keep Roman and his family in our thoughts and prayers. The other person I wanted to mention, of course, everyone's important, but I had a good friend, Bill Dubell, who passed away this week from complications from COVID. Bill was 95, and Mayor, you may remember, I think you were there when we dedicated Jane Dubell Park off Callahan. This is Jane's husband who passed away, a veteran, a rancher, just a good, decent man we lost this week. And probably both the most inspiring but also the most heartbreaking part was he was married to Jane for 74 years, rarely left her side, and unfortunately, she couldn't be by his side in his last few days. So, a reminder again to everyone, no matter your age, this virus doesn't discriminate, and we're losing good people every day. So let's keep Jane and the Dubell family in our prayers. Thank you, Mayor.
Thank you for that, Commissioner, and we do want to send our condolences to the Dubells and all the family and community around them that have loved them over the years and who they loved back. Also wanted to let you know that there have been several calls with state and federal health officials over the last several days with mayors in Texas and across the country. We're all pushing the same message, which is that we need more vaccine doses. So we want to thank you. I know this has been a very frustrating process, but the patience that you're demonstrating, allowing those vaccines to come in and get out to the community that needs them is very important right now. We're going to work every single day to bring more vaccines to our community, and we'll keep you posted along the way. We also want to remind you that if you are struggling through this pandemic, paying rent or mortgage, there is an emergency housing assistance program for you. You can get more information by calling 311 or going to the website covid19.sanantonio.gov. Also, if you're out of work, have lost a job, and are without income because of the pandemic, we do have a job training program, which is training for jobs that are available right now in our community while you receive a stipend to help make ends meet. You can enroll in that program by calling 210-224-HELP. And as always, you can get the latest on COVID-19 by texting COSA.gov to 55000 or by going to the website again, covid19.sanantonio.gov. We are trending in the right direction, hopefully. I'll call it a trend for right now, but we'll confirm that by the end of the week. If these numbers continue to move in the direction that they are, that is a good thing, and it's long awaited. So please continue to do the work that you've been demonstrating to protect lives, including your own. Mask up, practice social distancing and proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. Dr. Bridger, myself, and the Commissioner are available for questions.
Do you guys know how many people in San Antonio have at least had their first first COVID-19 vaccine? Do we have that data?
It was on the sit rep today. I want to say maybe 190 something. We can get that for you.
Yeah, it's according to the website, the state website, it's 113,400 some odd folks, but we know that that's a couple days
Yeah.
behind the real number, so it's above 115,000.
As you guys begin to make a dent in San Antonio's population, I know Tier 1A and 1B makes up about 1 million people, or 60% of the city. Obviously, there's still a way to go, and like you said, you guys are trying to get more vaccines for the hubs specifically. I know you talked a little bit about that process. Do we anticipate any uptick coming anytime soon?
Well, we were on a call today, actually few calls today with White House officials where they are anticipating supplies to the states will now be made in 3 weeks ahead of time. They will be notified of what's coming. When that actually happens, the state has also told us that we'll get a 3-week notification when that occurs. And so if we get more advanced notification of supplies that are coming available, that will allow us to schedule more appointments in advance to give people peace of mind that they're at least have an appointment waiting for them. That hasn't happened yet. We anticipate it will. According to the White House officials, it's imminent, and we certainly will keep you posted.
We saw another big festival postponed again today, the Barbacoa and Big Red Festival. Has there been any talk about Fiesta? I know we hit on this topic once a week, but Fiesta's telling us that they are in conversations with you guys about it.
There has been, yes, and Fiesta Commission has been meeting with health officials. They have. I've had a conversation with them. They're anticipating an announcement on Fiesta within the next week.
Dr. Bridger, what goes into identifying a source of infection, and what types of questions do contact tracers ask, and how do those involve into case investigations?
All right, so let's flip that. It's the case investigation that happens first, and from the case investigation, the contact tracers do their work. So somebody who is tested positive gets a call from Metro Health or the School of Public.
This briefing is continuing right now at KENS5.com and our Facebook page. We got some interesting questions there at the end. We got an update from the mayor about an announcement regarding Fiesta, as we're all anxiously anticipating if we will get the Fiesta this year or if we will have to wait until next year once again. We also got to hear a little bit about the conversation between city officials and the White House regarding a 3-week heads up of what the vaccine supply is going to look like. Imagine knowing that vaccine, that shot is going to be there instead of what we have right now, somewhat getting signed up for the shot and then some places running out of it, and kind of finding a solution to that. So we are trending in the right direction in our hospitals, but sadly tonight, the mayor reporting 20 new deaths here in San Antonio and Bexar County, and he's asking everybody to say a prayer and remember these people. These are folks, family members, loved ones, and so many people have lost someone close to them as we've been fighting the coronavirus here in our community. We'll be right back after this break.